guys, welcome back to my channel. This is Dr. Bundi, the wellness doctor. I'm back again with a video. For those of you who are new, I make videos on mental health, so be sure to like and subscribe so that you can get a taste of all this goodness. So today I'm joined by a friend of mine. She's called Connie. I'll let her introduce herself and then we'll just get right into it, and I'll tell you why we are both here today.
Alright, thanks. So my name is Connie Tipis. If you are busty, you probably already know me from Double D's Lingerie, but I do wear many hats, and this is just one of the other hats that I wear. So I am a psychologist pursuing my MA in clinical psychology. So I intend to graduate and become a clinical psychologist, a certified one, right? And of course, as we go on in the video, we'll explain the differences between the different types of psychologists that exist in the country and in the world, right? So I think that's a pretty...
Yeah, that's spot on.
Spot on, right?
So
how did we meet?
How did we meet? So how we met is I walked into Connie's shop. As she said, she's the owner of Double D's, and I walked in and I was taken aback by how, I was just saying, how zen she is. Like, Connie looks like the sort of person who you want to talk to, you want to tell all your problems. Like, she's so centered. Centered is the word.
Oh, centered, yeah.
Yes. Yeah. So I didn't even know you were a psychologist at that point. But now that when I found out, I was like, okay, that makes 100% sense. So I guess maybe you can just tell us how you got into psychology in the first place. Yeah, how did you land on being a psychologist?
So I always tell people it was chance, right? A day before registrations closed for uni application, I was actually pursuing a degree in finance and accounts, things around math-related stuff, because that really came easy to me.
Yeah.
And so the day just before the deadline happened, I happened to open the letters, and I was like, you know what? Why not? So went to school.
Why not, guys? It's a really good reason.
Yeah, just why not? Yeah. And I think it was just something was calling me beyond myself, right? And I remember sitting in the first class, Introduction to Psychology, that's Psychology 101, and I remember sitting there and thinking, I do need to be here, because at that particular point I happened to be the person who had like a close-knit group of friends, and I think my personality was just one about if you don't make sense and fit into our group of friends, then you have no business. Yeah, you can't sit with us. Right, you can't sit with us type of mentality. And I realized that's not how you live life, right? Like, you've got to be open-minded, and especially when you're meeting different people and new people all the time. So that happened, and then after Psychology 101, the rest is history. And I realized, like, it changed a lot of who I am, and I try and pass that along to the people around me as well. You
really let people in so quickly, because like even when I met you, it didn't feel like how you just go to someone's shop and it's transactional and buys. Like, you just made me feel like I've known you
for a long time.
I can know you and like it's fine, I can sit with you. And that's really awesome. I think that's what everybody wants from guys in this mental health field, just to feel accepted as you are.
Yes.
So why are we here? I was telling Connie earlier how I feel like a lot of people might not understand the world of therapy, counseling, psychology, psychiatrist, like all those terms. Someone's head is probably spinning and they're like, what's all this? Someone is wondering, which therapy do I need? Where can I even start? And stuff like that, because of our culture.
Yes.
We don't have that culture of like going to see therapists as opposed to how it is in the West.
Yes.
So this video is all about that. The first part will be talking about the different type of mental health practitioners.
Yes, practitioners.
Yeah. So I guess you can take it away.
Yes.
You can start. Because I really feel like you have insight on something I don't, especially the world of psychology. Yeah.
So you're a psychiatrist, I'm a psychologist. So there's a huge difference. She's a doctor first. I didn't have to become a doctor to be a therapist, right? So the key difference, especially between psychologist and a psychiatrist, is that a psychiatrist is a medical doctor. So I think if somebody also came in with a tummy ache, you'd be the guy, right?
I'd sort you two in one.
I'd sort you two in one, right? But when you come to me, I'm more concerned about your mental health, right? So she can prescribe medication, especially for mental health disorders, but I can't do the same, right?
Alright, so we just talked about the first main difference, which is prescribing medication. But now a similarity is also psychologists use the DSM-5, yeah?
Yes.
Yeah.
So the DSM-5 is the diagnostic manual for diagnosing mental disorders. but not all psychologists can use the DSM-4. It's good to have it in mind, right? So a counseling psychologist, now that gets into the spectrum of the differences. So a psychiatrist will use a DSM-4, and a psychologist as well, and a clinical psychologist to be precise, would also use the DSM-4.
So what you're pursuing...
Actually, it's now DSM-5, yes.
So now you are pursuing to do your clinical psychology so that you can be able to diagnose.
Yes.
Okay. So I'm getting, let's say you go for therapy, and then someone comes to you for therapy, and you're giving them the session, and you feel like, okay, this could be a mental health disorder. You can actually diagnose.
Yes, you can.
So that's really important, because I feel like a lot of people are going for counseling, and then they're not getting redirected to see somebody who can actually now treat. Yes, yeah, because some things are bigger than just talk therapy or... Yes. All right, cool. So
and sometimes the reverse happens, where they come to a psychiatrist, and the psychiatrist just gives medication, but in all honesty, they didn't need the medication in the first place.
I'm so passionate about what you just said, because I feel like our training here, this is just a small criticism to psychiatrists. Our training is purely psychiatry.
Yes.
Whereas it's, as you said, it's not just about meds. So first of all, not everybody needs meds.
Yes, not everybody. And you get hooked on the meds.
You get hooked
so
on the meds.
So once you're on them,
you're not able
going to be very hard to get off them.
And then not some people even who need them don't end up getting the therapy. So it's just refill of medication, refill, and then they never get the. So a good psychiatrist, it's like it should be a blend of both.
Yes, a blend of both.
All right,
and that's cool. One thing we say in this discipline is that you don't work on your own. So it's you have to integrate everybody. So the lay counselor who probably doesn't have the educational background, but probably had like a 3-month training.
Yeah.
And then the psychologist who's been to school, got a degree, got a master's, a PhD, and then a psychiatrist. Because at that particular point, if somebody needs meds, there's really nothing much. You could be in therapy for years and they will never get over it, because it's actually a mental health disorder, like something like schizophrenia. You need meds to balance out your moods at that particular point.
Exactly. Yeah. Okay, so I wanted to ask one more thing. What are counselors? Or plain counselors?
Plain counselors.
Yeah.
So in the field of psychology, there are multiple, like I call them semi-disciplines, or like these little tiny segments of it that differentiate us all, right? So there's the psychologist, and when you do psychology, you can either practice counseling psychology, and I'll use the word normal loosely, because I'll use normal and abnormal, but that's just loosely used, right?
Yeah.
So when you're a counseling psychologist, you're dealing with normal people problems, in quotes, right?
Normal
like everyday type of things, like that don't translate into a mental disorder. So maybe you're having issues with stress that hasn't gone to the point where it has clinically affected your life.
Okay. All right.
So at that particular point, it hasn't maybe morphed into depression or morphed into substance abuse on the level that is extensive. You can see a counseling psychologist.
Okay.
And at that particular point, your counseling psychologist is just your guide. So what they do is they guide you, they create self-awareness in you, so that at least you can identify your problem and come up with your own solutions to your problem. So they're just a guide. You do the work.
I think everyone needs a counseling psychologist.
Yes.
So that's what's probably happening in the West, because everyone out there is seeing somebody to talk about their transitions in life. Let's say, okay, I get it. So counseling psychologist. So what's the other type?
So the other type is now a clinical psychologist, for example. So a clinical psychologist is more on the medical side and dealing with things that are now beyond your normal problems. So disorders like schizophrenia, bipolar, major depression, psychotic breaks, things around that field where medication is now involved. So in the West, I know that clinical countries, like I think the UK, if you're a clinical psychologist, you can prescribe medication.
Okay.
And even a clinical psychologist must understand the medication prescribed by psychiatrists, because if you come and you probably have medicine and you're having an adverse reaction, I should be able to ask you, so what medicine are you on? And I would know, like, is this an episode or is this being triggered by the medication?
I love the synergy. In fact, there's a psychologist I've worked with, and she picks up the phone and calls me and tells me, okay, this guy, his medication, it needs to be
balanced.
So there has to be synergy. I loved what you said, that you're not an island, you can't work alone.
Yes, you cannot.
Okay, so I get that. So you talked about counseling psychologists, clinical.
Then there's now organizational psychologists, and those ones are now people who work with major organizations, like trying to evolve their culture, if they have a problem, organizational culture, things around industry, right? And then the people who also sit down and think about ads, like, do I want to sell this product? And you know, so there's a lot of psychology that goes even behind the marketing. So because obviously if I'm selling you this notebook, I need to be able to sell it to you in a way that you would want to buy. So there's a lot of psychology. I would know this color might work, but not a different variation of this color, right?
That's so true, because I read something around like some banks use certain colors, like different industry. I was like, okay, so psychology is like bigger than just
your everyday type of problems, right? So but then that's now like extensive, that's interdisciplinary, that is just extensive. So let's go back to Kenya, where now you could do a 3-month course and become a counselor, right?
There are so many counselors,
and that's where the problem happens in Kenya. So like, let's focus to this point now, right? So there are people who go for a 2-week thing and they're lay counselors, and they come and they purport to be counselors, and they do more harm than intended. So there's a person who will go for peer counseling. So that's like just a 2-week course to teach you the basics about psychology. But that's not the person you should necessarily see, especially if your problems are beyond.
Bigger,
bigger, right? So you should go see somebody, and a good counselor will be able to tell you, you know what, this is not my area of competence.
We have such a problem with people just admitting that
you can't do it,
and we are putting, you know, the problem is the person who ends up suffering is the patient.
Yes.
Because they're just like, okay, therapy doesn't work, but then maybe it's the type of person that you went to, or it wasn't suited for you.
Yes.
Okay. There's something I wanted to ask. So so there's someone who's watching this and they're wondering, so how do I know who I need?
Who you need. Right. So think about therapy and getting a nice therapist for you as buying a handbag. It's about your preference, right? So when you don't go to the first therapy, sit down and be like, you know what, this one works for me, this is the person I'm going to work with. No, it's shopping, it's window shopping. So you sit down for about 30 minutes to an hour with a therapist, and your therapist should make you feel comfortable. Because the 3 basic principles of therapy are, somebody should offer you unconditional positive regard, meaning you shouldn't feel judged by them. So no matter what, even if you come and say, you know what, I'm an atheist, they should be like, okay, sawa, let's go on.
They shouldn't be like, for you.
Are you sure? Do you know the Bible says in Revelations that you're gonna die, right? At that particular point, just say thanks and I'm out. You're out, right? The next thing is they should be in the same frame of, like, they should share the same principles as you to some sort, like, because if they're not able to distance themselves as well, then it becomes a big problem. Right? So you have to ask your therapist their area of competence. What do they do?
So it's okay to interview your therapist and ask a few questions.
They're gonna mess up your mind, so you might as well get, ask questions. You don't go see, you go see a GP, I guess, when you're going to like see a doctor, and then when they think you need extra specialized help, they send you to the next person. And the person will have a title, maybe dermatologist, clinical, right? So in the same way with the therapist, because we're all like just psychologists, and unless you have like a PhD or a doctorate degree, like a doctorate, you'd want to ask the therapist, so what is your area of competence?
Exactly, because that can even save you so much time and energy if you just figured out from the beginning, okay, this is not what I need.
What you need. And then different therapists will tell you the different fields there, like where their interests and passions are at. Like for example, I avoid seeing children, because I just feel like I will not be able to separate myself from that, right?
That's why I didn't do pediatrics. I get you.
I would not, because then I just imagine a scenario where maybe the child is being molested, the parent is aware, and the parent is taking that relationship. I feel that I get so angry and enraged that I'm unable to separate myself from the whole situation. So the one thing, again, you could go and see a couples, family therapist, things like that. So everybody will tell you their area of competence, and when you sit down, they will ask you and they will explain to you. And it's good to ask. So the only problem I feel like with most people here, because it's a new thing, is that we avoid asking the question. You let the doctor prescribe.
It's like you feel like you're at the mercy of the doctor or the therapist, whereas it's a collaborative effort, isn't it? So I think that's that. We can start heading over to the second half of the video.